Why do copper and hormonal IUDs prevent pregnancy differently? Imagine two types of devices that keep you from getting pregnant, but they do it in very different ways. That's what makes copper and hormonal intrauterine devices unique. Copper IUDs are made of plastic with a copper wire wrapped around them. They work mainly by releasing copper ions into the uterus. These copper ions create a hostile environment for sperm, making it difficult for them to move and survive. The copper also triggers a local inflammatory response in the uterine lining, which is spermicidal, meaning it kills or disables sperm. This reaction also changes the cervical mucus and fluids in the fallopian tubes, making it harder for sperm to reach the egg. The copper IUD mainly prevents fertilization by impairing sperm function. It does not interfere with ovulation, which is when the ovary releases an egg. Because it is hormone-free, it's a good option for people who prefer non-hormonal birth control. Copper IUDs can also be used as emergency contraception if inserted within 5 days after unprotected sex. Hormonal IUDs contain a synthetic hormone called levonorgestrel, which is slowly released into the uterus. This hormone thickens the cervical mucus, creating a barrier that makes it difficult for sperm to swim through. It also affects the muscles in the fallopian tubes, making it harder for the egg to travel to the uterus. The hormone can also thin the lining of the uterus, which reduces the chance of a fertilized egg implanting. Unlike copper IUDs, hormonal IUDs may sometimes stop ovulation altogether, but their main way of preventing pregnancy is by blocking sperm and making the environment less welcoming for fertilization and implantation. Over time, hormonal IUDs can also reduce or even stop menstrual bleeding, which some people find helpful. So, in simple terms, the copper IUD works mainly by creating a toxic environment for sperm through copper ions and inflammation, preventing fertilization. The hormonal IUD releases a hormone that thickens mucus, changes fallopian tube activity, and thins the uterine lining, also preventing fertilization and implantation. Both types are highly effective and long-lasting, but they do have different side effects and mechanisms. Your choice depends on your health needs, preferences, and whether you want to avoid hormones or not. Always talk to a healthcare provider to find the best option for you, and remember that these devices are reversible and safe when used properly.